Welcome to iCON virtual event. My name is Barbara Ho. I'm a registered nurse. I'm also the Chief Nursing Officer of iCON Chinese Division. I will be the Master of Ceremony today. People who are joining online, how are you? Welcome to iCON Chinese online forum. The topic is Healthy Living, Healthy Heart. Some friends only participate in the event which are organized by iCON. I give you an overview of iCON. iCON is one of the projects initiated by Digital Emergency Medicine of Faculty of Medicine, UBC, and led by Dr. Kendall Ho, have been established for over 16 years. The main purpose is to help busy multicultural groups, patients, their families, by reliable health information, community resources, and network in respect of chronic disease, education, prevention, and cell management by way of forum, workshops, and web technology. To help patients with awareness, best health practices, to reduce this disease risk and advocate for formal therapies, help them access reliable health network and electronic tools, and helping them more familiar with technology and how to improve the health quality, especially know more about the electronic tools. Welcome to the second day of the forum on healthy living and healthy heart. Yesterday, we give an overview of heart disease, what is atrial fibrillation and its symptoms, and how to mitigate the risk factors. And also look into some electronic tools and online resources, helping people to self-manage. Today, we would like to know the difference between men and women with heart disease, and also to reduce stress in order to minimize cardio event. And we'll also learn how to do some practical self-help and lifestyle management to help you stay active. And I would like to introduce the special speakers. The first one is Tara Salak. She's a cardiologist. She is a PhD of medicine of UBC and complete internal medicine and cardiology training. And also she completed specialist training on women's heart health from a university in California, Los Angeles, especially focused on women without any obvious coronary arterial disease, but will have heart discomfort. The next one is Dr. Yang Taylorson, a registered psychologist in BC, practice in a clinic in BC, and also he is also a part-time instructor in many universities in BC. And also every month regularly, he co-hosts a program with AM 1470 with Deborah Moore. And lastly, there are two registered physiotherapists in Canada. First one is Nicole Dye. She was born in Australia, but growing up in Vancouver. She completed University of Toronto and also in Hong Kong. And she is now taking advanced training in acupuncture. And the other one is Emily Pack. She completed the Bachelor of Science in Hong Kong and also kinesiology and Master of Health Science. She has been practiced at physiotherapies for over 15 years. Today we will also provide some resources to two resources in the committee, especially relating to today's topics, including the Heart and Stroke Foundation of Canada, and the Health Ling BC, and also help let people learn how to navigate the iCON website. Good. So now, without further ado, we will have the first speaker, Dr. Tara Stelak, and tell us about the difference between men and women with heart disease.
Right. Good morning, everyone. And thank you for asking me to join this really exciting seminar. My name is Tara Sedlak, and today I'm going to be talking about women and heart disease. So I wanted to first start off by looking at some of the learning objectives in this 20-minute talk. And so today I wanted to talk about sex and gender differences between men and women with respect to heart health. I also wanted to talk about some of the unique risk factors that we see in women only, and some of the unique signs and symptoms of heart disease or a heart attack in women. And finally, how to manage heart disease and when to seek out help from community resources. So the scope of the problem is large, and there was a misunderstood report that came out by Heart and Stroke now back in 2018, so over 5 years ago. It was really informative, and some of the data from them showed that cardiovascular disease is the major leading cause of death amongst women in Canada. And most women and men don't know this, but women are actually 6 times more likely to die of cardiovascular disease than breast cancer. Also, 60% of heart disease in women presents as a heart attack with no warning signs. And so certainly you want to get on top of your risk factors for a heart attack and, of course, the signs and symptoms of a heart attack early. So heart disease in women is common, we know that, and it's a major leading cause of death in Canada, but only 30% or 37% of young women in Canada believe that heart disease can be different than for women compared to men. Only 28% of women know that heart disease and stroke are the leading cause of women's death worldwide. And finally, only 20%, so 1 in 5 of women's doctors talk to them regularly about their heart health. So what are the risk factors for heart disease? Well, actually, there's 9 risk factors that account for about 90% of the risk for heart disease. And they include high blood pressure, alcohol intake, high cholesterol, inactivity, obesity, poor diet, diabetes, smoking, and psychosocial stress. And what we know is that diabetes, smoking, and psychosocial stress are actually stronger risk factors in women compared to men. For example, if I have a woman in my office who has diabetes, and I compare that to a man who has diabetes, I am much more worried about the woman with diabetes in terms of her heart risk moving forward because she's much more likely to develop heart disease than a man with diabetes. So we know that there are sex-specific risk factors, and these are risk factors that can actually only be found in women. And until we actually started researching women and their heart disease risk factors, we actually didn't really know that these were risk factors at all. One of them is something called polycystic ovarian syndrome. And this is a condition where you can have changes in your metabolism. You can sometimes have changes in your weight. You can have cysts that form on the ovaries. You can have changes in your menstrual cycle. And you can have higher cholesterol and higher fasting sugar. And all of that places you at increased risk of cardiovascular disease many years down the road. We also know that other risk factors during pregnancy are very important. For example, gestational diabetes. So if you develop diabetes only during pregnancy, but never again, that actually puts you at a 2-fold increased risk for future cardiovascular disease. Other complications like high blood pressure during pregnancy, preeclampsia, which is essentially toxemia, where you can get a lot of swelling during pregnancy, more than you would expect, liver dysfunction, neurological changes that can put you at increased risk. And then some actual pregnancy-related complications where you have a premature delivery or stillbirth. We know that that can increase your risk of cardiovascular disease, again, many years down the road. Finally, we know that there are risk factors related to menopause. So certainly after menopause, the risk for cardiovascular disease in a woman sharply increases. And in fact, I have many women in my practice who say, geez, my cholesterol and my blood pressure was always normal or very low, and now suddenly it's gone up and I'm 55. What's happened? Well, they've gone through menopause, and with the changes in menopause, those risk factors have increased, and therefore they're at increased risk for heart disease. And we know that if you have young menopause, so early menopause, sometimes called premature ovarian failure, where you have menopause before the age of 40, you actually have a 95% increased risk of having a future heart attack. Inflammatory risk factors are actually being developed as risk factors as well, and lots of study has gone into this. So conditions such as rheumatoid arthritis, which many of us are familiar with, can lead to joint pain and swelling. Also lupus or systemic lupus, where you can get rashes on the face, inflammation of the hands, impairment of the kidneys and other organs. All of those inflammatory markers increase the risk of heart disease and sometimes double the risk of heart disease. And these are actually much more likely in women. For example, lupus is found 90% in women and only 10% in men. Breast cancer is very interesting. So breast cancer survivors now are very common, where women with breast cancer are actually doing very well for the most part. We've had all sorts of advances in terms of medications, chemotherapy, radiation therapy. However, interestingly, now a woman can survive breast cancer, but actually be at increased risk of heart disease because of some of the therapies that she's had. So, for example, certain chemotherapies can put you at risk for something called heart failure, which is where water backs up into the lungs and into the legs. Radiation therapy, which actually overlies the heart, if you have left-sided breast cancer, you can actually get some scarring in the arteries leading down to the heart. And that long-term scarring from radiation can put you at risk for having blockages, and those blockages can put you at risk for heart attack. And finally, mental health. And mental health is extremely important, particularly in women, but also in men. So we know that depression and anxiety can increase a woman's risk for a cardiac event by upwards of 50 to 70%. Those are pretty huge numbers. And that a very stressful event, such as death of a loved one, loss of a job, can actually cause a heart event. And that's called a stress-induced cardiomyopathy, where literally you have a broken heart syndrome, where your heart actually fails to function well. You can actually be at risk for heart failure. And that can all happen because of a very stressful event. And this happens 90% of the time in women. So there is a specific interaction between those types of events and hormones and female sex. So let's move on now. We've certainly reviewed some of the risk factors. We know that there are sex-specific risk factors related to pregnancy, menstrual abnormalities, and also related to menopause. We know that inflammatory risk factors, breast cancer, and also mental health are very important. What about the symptoms of a heart attack? Could that be different between men and women? And I love this quote. This is from Carolyn Thomas. She does a lot of work on the internet and social media. She's a heart attack survivor. And she said, in my mind, the stereotypical heart attack was an old guy clutching his chest on a golf course. Women need to know that they can have a heart attack, yet still continue to walk, talk, and work. And that was her experience. And she talks all about it in some of her books and in some of her online work. Suffice it to say that learning the signs of a heart attack is obviously very important. And that in women, still the number one symptom that you can experience is chest pain when you're having a heart attack. So it's still very important to look at chest pain as being a major symptom. However, we know that women, number one, can experience their chest pain differently. So men classically would describe it as the elephant on the chest or a lot of pressure on the chest. Women actually describe their symptoms differently. So they can describe it as a tightness or as a squeezing. And sometimes that can be misinterpreted by themselves or even by practitioners saying, oh, geez, this doesn't really even sound like a heart attack, when in fact it still is pain in the chest. Women can also have lots of other symptoms. So they can have just jaw pain, or arm pain, or pain radiating from the chest up into the neck or through to the back. And that can be really confusing because some women have said to me, geez, I thought it was just a bad toothache, when in fact they were having a heart attack. And then finally, women can get other symptoms associated with their heart attack. So not only can they get pain, but they can get shortness of breath, they can get sweating, they can feel really lightheaded or nauseous, along with some of the other symptoms that I've described. And so at the end of the day, if you're experiencing something really serious, a real change in symptoms, and you're having a lot of these signs and symptoms, don't delay and seek help. We know that in addition to differences in signs and symptoms, there can be differences in the causes of a heart attack in women. So I think most people think, geez, well, a heart attack must be caused by a blockage. And still, that is the most common cause. And the blockage typically, there's cholesterol in the artery, there's a clot that forms, and then you get this big 100% blockage, and there's no flow down the artery. And so that causes some death of heart muscle. And that's sort of a classic heart attack. We know in men that causes over 97% of heart attacks. So we know that when we do a specialized test called an angiogram, where we feed a catheter up, a little tube up to the heart, put dye into the arteries, we're going to see that blockage, and hopefully we'll be able to fix that with a balloon and a stent, or sometimes bypass surgery. However, only in 85% of women is a heart attack caused by that kind of blockage. So 10 to 15% of the time in women, if we're doing that angiogram and looking for a blockage, we won't find it. And sometimes we won't know the cause for the heart attack. So we now know, in the last 10 years, we've done a lot of research on this. We now know that some of those heart attacks are caused not by blockages in the arteries, but by some other things that can occur inside the arteries. So for example, you can get an actual little tear inside the artery where the lining of the artery can tear, and that's called a dissection. And that little tear in the artery can be so small that you can put dye into the arteries. And if you're not really looking for that tear, you can actually miss it. And that can cause a heart attack. We also know that spasm of the arteries, so where the artery starts off completely normal and then it spasms down really tight, and then opens back up again. That's called coronary vasospasm. And that can cause a heart attack. But unfortunately, if you do the angiogram, put dye in, and it looks normal, maybe it's because you didn't catch it right when it was spasming at the time of the event. And finally, we know that in women, they can actually have plaque inside the arteries or some sort of clot causing the problem. But sometimes it's further down in the arteries. We may not necessarily see it right in the large blood vessel, or sometimes it may have resolved by the time that you get the angiogram done. And so we may not necessarily be able to see it on the angiogram, and we'll just say, geez, everything looks pretty good, when in fact they did have a blockage, but it had resolved. We know that women are more prone to small blood vessel disease. And what I mean by that is we have the large blood vessels surrounding the heart, which is what we were just talking about in terms of blockages, tears in the arteries, spasm of the arteries. But actually there's the tiny micro blood vessels that funnel right down into the smaller parts of the heart. And those are called micro blood vessels. And those can actually become dysfunctional, and they can become blocked, they can become tight. The lining of those blood vessels can become abnormal, and that can cause sometimes a heart attack, but more commonly, it can actually cause severe chest pain. And this is way more common in women. So again, 80 to 90% of microvascular disease is found in women. And there are some reasons for that. We have smaller size vessels, we have more stiffness in the small blood vessels. But suffice it to say, it's more common in women, and it's difficult to diagnose. And so now we are able to diagnose this small vessel disease at Vancouver General Hospital. We're one of the only places in Canada that can diagnose this disease. And what we have developed and what we've brought to VGH is a specialized type of machine. And this machine can actually, during an angiogram, where you put dye into the large blood vessels, test them, you note that they're normal, you can actually put a catheter down into the small blood vessels and actually test their function, where you can actually now see that there will be small blood vessel disease and abnormal function of the small blood vessels. And we can actually give some of these women who've had chest pain for years and been told that there was nothing wrong, we can actually now finally give them a diagnosis. So finally, in the last 5 minutes, I want to talk about how to prevent and manage heart disease. So first of all, prevention is obviously very important. So we always say to people, you should exercise, but really at the end of the day, you should exercise frequently. You should try to exercise such that you get your heart rate up to a certain heart rate, and your practitioner can help you sort of develop what heart rate that would be. And you should try to do that at least for at least 30 minutes, 5 times a week. We also know that there's healthy diets, and that a Mediterranean diet in particular can be really helpful for preventing heart disease. And with a Mediterranean diet, high in fruits and vegetables, chicken without the skin, fish, low in red meat, low in eggs, can be really helpful. Stress management, I think I've mentioned particularly in women that stress can be a risk factor for heart disease. It can be a risk factor for that broken heart syndrome that we were talking about. And so really getting on top of stress management, counseling, doing various things like yoga that might be helpful, whatever it is in your life that you feel would be helpful for stress management. Smoking, we know that smoking is actually a greater risk factor in women compared to men. And so, obviously stopping smoking would make a big difference. And if you stop smoking for long enough, sometimes your risk goes way down, even to the level where it's like you never smoked. So certainly trying to stop smoking, minimizing alcohol intake, a few glasses a week, I think is reasonable, but obviously a lot of alcohol can cause various syndromes in the heart. And then finally, maintaining a healthy weight. So in terms of what you can do with your practitioner, or even what you can do on your own, is you can check your risk factors and get your risk factors checked. So you can check your blood pressure regularly. And you can do that at home, you can do that in a pharmacy, you can do that with your family practitioner, just to make sure that you know your numbers and you know whether or not they're abnormal or normal. And if they're high, getting them treated early. You can have regular blood tests done. And with those blood tests, you can have your cholesterol checked, you can have your fasting blood sugar checked, and you can see whether or not you may have some evidence of diabetes, again, which we've said is a very important risk factor. Just having regular visits with your family doctor and or your specialist. If you actually have underlying heart disease, seeing your specialist regularly. If you don't have heart disease, getting regular visits to your family doctor to get some of these risk factors checked up on is important. Cardiac rehabilitation programs. So many people, after they've had an event, both men and women, heart attack, bypass surgery, they will attend what's called cardiac rehab. And this is actually available at many different hospitals. Even smaller hospitals have this resource. And there's essentially a dietary program, an exercise program, and it's supervised. And so a lot of people, it helps them get back into an exercise program after they've had an event. And then finally, seek trusted resources and training online or through your different practitioners on how to live with heart disease, which is obviously very important. So finally, when should you seek help? And this is not always clear to people, but certainly if you've checked your blood pressure, you've looked up your cholesterol online, you've looked up your sugar online, and you can see that it's not within where it should be, and it's uncontrolled, then I think you should seek help from your practitioners. Certainly if you have a strong family history of heart disease, but you don't have any of those other traditional risk factors, but you have lots of family members where they have had a heart attack or a stroke, particularly at a younger age, I think, it would be helpful to go to your practitioner and ask to be screened at a younger age because you have this premature heart disease in your family. And finally, if you have worrisome symptoms, so some of those symptoms that we described before, particularly in women, chest pain and shortness of breath and lots of other associated symptoms, if something at the back of your mind is just saying, this is not right, this is new for me, I'm concerned about this, then I think you should absolutely go out and seek help. So in terms of resources, we have the Heart and Stroke report called Misunderstood from 2018, and it's still very relevant now 5 years later. So I would really recommend that you have a read through of that. We also have the Canadian Women's Heart Health Alliance, and this is an alliance that we built over 5 years ago. It's made up of women with lived experience, so patients who have had heart events or who are at risk of heart events, allied healthcare, so nurses, dietitians, other practitioners, and then of course physicians, cardiologists, family practitioners, and it's across Canada. And we've actually made up some online tools and resources, and there are some very interesting infographics on different types of heart disease and different risk factors for heart disease that you can certainly have a look at, and those are available in many different languages. Finally, there are some community resources to link HealthLink BC. 811, of course, is your health system navigators 24 hours a day, and Chinese speakers are available. And also there's a UVic self-management program. And again, Chinese speakers are available. So have a look at some of those great community resources. So they're just showing you again the community resources, the Canadian Women's Heart Health Centre and the Alliance, where there are a lot of resources on there. And then, of course, the Heart and Stroke Canada. So with that, I would like to end off and thank you again for allowing me to participate, and have a great day.
Yeah, I can start my video. Okay, 好多謝
Okay. Thank you, Dr. Sitlak, for your very detailed and very special presentation on women and heart disease. And she's already taken us to some of the community resources, and one of them is the Canadian Women's Heart Health Centre. But this is this Canadian Women's Heart Centre is from University of Ottawa's Health Institute. They founded that health centre to help the public to understand more about women and heart disease. They have done a lot of research, and they hope that through these articles and their website, they can enhance our care and improve the prevention of coronary artery disease in women. So they have ongoing studies and research, and they publicize and educate the public about women and heart disease. So you can browse their website and learn about the details. For the time being, it's only available in English, but I have a little bit of time to share with you my own experience. Just now, Dr. Sitlak mentioned that a small blood vessels disease, I have been diagnosed of that. At first, I didn't realize that, but I heard people often say that if you do activity, if you feel that your heart, there's angina in your heart, then you should pay attention. So when it first started, because I went grocery shopping, I took the groceries from my garage to back to my home. But with such a short distance, I already felt discomfort in my heart and neck. So I went to see a doctor. The doctor first gave me a stress test. So I was put on a treadmill and see what if I went too fast, if there were any problems with my heart. So I had to do it 3 times. I failed all 3 times. So it was confirmed that my blood vessels and that supply to the heart was not enough. So that's why I had this angina, and my feeling was in before it radiated from the chest, then it went up to the neck, even to the jaws, just like Dr. Sitlak as the same thing. So I was curious. So in the end, the doctor dilated, made the scan of my. I didn't have the 3 eyes. Any of the 3 eyes, everything was normal. All the indices were normal. How come I had angina? So after I saw the doctor, I was told that I have this small microvascular disease. Yes, so I had to be put on medications, and the doctor explained to me, look, even you don't have any of the 3 highs, still you have to maintain stable beating of your heart. Don't let it go too fast. So the doctor will prescribe some medication to lower my blood pressure as well as lower my cholesterol. Of course, during exercises, I had to find time to do that to have good time management so that I could maintain a regular heartbeat. So this is my experience that I wanted to share with you. And now, just now, Dr. Sedlak also mentioned that mentioned stress management. So you have to pay a lot of attention to that because for those who have heart disease or those who do not have heart disease yet, they still have to pay a lot of attention to that. So we're happy to have Dr. Tiger Sung Young, a registered psychologist, to talk about stress management and to teach us some strategies to lower our stress and lower our risk of heart disease. Okay, welcome Dr. Young to be here in person with us.
Oh,
Good. How are you? Are you happy to see me and listen to me? Good. I'm so pleased to be invited by iCON to have an opportunity to meet everyone. And I'm so glad that so many friends, old pals, come together to learn about the health of vascular health and also heart health. We have already got some very wonderful information yesterday. I hope that helpful. So I would like to try to look at it from the perspective of psychology to share whether or not the mental health, the mood health, whether or not have any impact on the heart condition and also the okay, thank you. Today the presentation would help a couple of things. The daily stress, whether or not it will help impact on our heart disease, whether or not we understand the stress and how to respond to those stress. If you have any questions, just like Barbara told you, you can put in your question in the Q&A and then write the question. I hope to answer your question today or later. Let's first of all look at whether or not in Canada, how many people is suffering from condition with cardiovascular disease. In September, which is brand new studies. The Statistics Canada released a report. Let's see the report tell us what the report tells us. They are very great. They have conducted many research. From time to time, they will search out the health information and look at the health condition of Canadians, like how many of them have chronic disease or mental health quality, or whether or not we are active enough. What about the age factors? This report of this year, let's go back to the previous one. There are a couple points which is important. In Canada, Canadians have a long life expectancy. We average 81.7. Women are always live longer than men. Average for women is 84, and for men is 79.5. Over the last 2 to 3 years, mental health condition have been deteriorated. Well, we can understand that. The last couple of years during the pandemic, we have more stress. We have more behavioral or mental mood challenge, which is normal. The next slide. Well, today's topic has something to do with this one. The prevalence of some chronic conditions increase, like the hyperplasias, from 16.9% in 2015 to 70.7% to 2021. And also heart disease jumped from 4.4% in 2015 to 4.9% to 2021. And obesity is more serious, from 26.1% in 2015 up to 29.2% in 2021. Fortunately, the lung cancer incidence have been declined. But the report also indicated the low-income family has a greater degree of chance of arthritis, high blood pressure, diabetes, chronic disease, heart disease, and stroke than the high-income company. 1 in 12 Canadians experience multi-morbidity, which have increased from 7.5% in 2015 up to the 13.1% in 2021. There are another indications that in Canadians reducing their physical activity. But unfortunately, the smoker and drinker are decreased slightly. And the last 86% of Canadians has a regular family doctor, but 14% don't have a regular family doctor in Vancouver. Unfortunately, I believe only 14% of people in Vancouver have a regular family doctor. Let's go back to the area that whether the disease relating to the cardiovascular disease. Unlike, it is not only happening in Canada. In September is also a new report in China. There's the Biomedical and Environmental Science Agency. They refined that in 2022, they give you an update of the summary of the psychological condition in China. The incidence rates have been increasing in China. The number of patients with CVD is estimated to be 330 million. 30 million with 4.87 million with atrial fibrillations and 2.5 million with rheumatic heart disease. In China, there are 1.4 billion people population, so 1 in 4 of them have heart disease conditions. Yesterday, we have heard many information about what are the symptoms of these heart conditions. Without telling you, you would not know about this. Other than the physical symptoms, when we have suffering on this heart disease and we have some mental or behavioral symptoms. Next slide, such as anxiety, depressions, and poor appetite, sleeping problems, and memory decline, and also mentally more irritable. It's understandable when we are not feeling well, our mood will be compact. It will be affecting our behavior. But not to mention about disease, even though skipping a meal would make us unhappy. In psychology, we are curious to know. Let's look at it from the other way. Will emotional or mental health condition will lead to cardiovascular disease or some heart conditions? Many research have been conducted. Next slide. The degree of optimism and good health is closely related. Interlinked. Next slide. 2019, a medical publication in USA released a report. This report have collect 15 studies of research. Over 200,000 people have been collected, and the data of those and put into the meta-analysis. Through this, this is found, discovered that whether or not the degree of optimism is related to our health conditions. The data show that the most interesting part is include a ongoing follow-up research to up to 2 to 40 years. So on average, it's 14 years follow-up. So it is very representative. The next slide. And the findings of the study is that the optimism is going to help us to reduce heart disease and stroke by 35%. Cardiovascular down 14%. Especially, and in particularly, this is factor have nothing to do with the age group. It will be so helpful whether or not you are at different age. So, do you want to be making a fortune? If you want to making a fortune, it's simple. You just need to be optimistic a little bit, then it will help. Because the psychological condition is closely related to our health conditions. There's a trend that we're looking at this. Look at it from the two school of studies, and we call that psychocardiological disease. In brief, the double heart disease. I think you have never heard of it. It's not saying that you got two heart or I have too many heart. Well, the psychology and cardiologically we are related. You have heard that sometimes the doctors are the indicator is rated to the heart condition over the last 20 years. The next slide. The psychocardiological disease have been more researched by the practitioners. In a science cardiovascular medicine publication, have published a study from 2001 to 2021. They have made some analysis. It was found that from 2001, all over the world, only 65 reports are on the physical cardiovascular topics. But in 2021, there are 476 reports. So if my balance in the bank account can increase like that, it would be great. So the psychocardiological study have been more important now. Since this is so related, it has so much impact on our heart condition, we need to know about whether or not how much we are stressed. Dr. Sai have already told that we have a heart disease, but we don't know about that. I'm not sure whether you are also in a condition, whether or not you are aware you are under stress. Is it very interesting? Let's put it this way. It doesn't mean that there are no signal. Our body are very smart. And it sends signal to us. Well, he's coming, that you are stressed. Even though our body or our mental or mood condition will be sending signal to us. Next slide. Physically, there will be a symbol of the following. There will be pain, heart pain, the stomach pain, behaviorally, we are low appetite, sleeping problem. Those are all the signals. Mood, in terms of mood condition, there are signals like nervous or we are upset, and also withdrawn or irritable. Those are the signals sent to us by our body. He is coming. You are stressed now. Do you know that? There were a tendency to try to omit them or overlook them or dismiss them. But if over a long period of time we try to dismiss those signals, it will accumulate to a certain degree. It will impact on our health conditions or functioning. So how to treat the double heart disease? In 2022, there's Frontiers in Psychiatry's publication released a report. One of the area is to treat the problem from two ways. When we are having a heart disease or cardiovascular disease, we only look at the physical symptom. We overlook the emotional symptoms. So when people are trying to get treatment, we don't look at the other side of the problem. We only look at the physical side. We don't look at the mental condition and the mental need. So this report, it indicated that one of the area that treatment should be changed is to include the other side. Both sides should be treated. There's a way of treating to using anti-depression medicines or anti-depression medicines, and there are some mental therapy like the cognitive behavioral therapy, positive thinking therapies. It will be helpful to the double heart disease. Next slide. What is the cognitive behavior therapy? It will be helpful to change the way of thinking. Remember, we have talked about this. If you want to making a fortune, no, not buying 649. You have to be a little bit optimistic. Exactly. Optimism is not only from your character. Most of the time, we always say that it's a character that a person become optimistic. Well, of course, it's a character. Actually, it's a way, it's a behavior. Optimism is in our brain is a exercise of the muscle in our brain. In other words, you can train your way of thinking. How to train your thinking? First of all, we have to be aware. We have to start with awareness. We have to start to observe how we are thinking, in what mode of thinking we are in. After the awareness, we could conduct a daily exercise to change the way of changing day by day so that it will change over a long range of time. Many people told me that, oh, it's very difficult. Well, it's not easy, of course. But it's not easy doesn't mean it's impossible, right? Say, every day, don't be too aggressive. Just change 1%. Just one tiny step every day. After 3 weeks, we have changed 20%. So changing is requiring commitment and also endurance. If you can keep doing it for 4 to 6 months to be trained and to spend time to change the way you think, the perspective, you can see the health wealth accumulate. The next slide. Double heart disease is a new direction of perspective. Look at this problem. The good news is there are room for improvement. There are many things can be done. One of the way to change how to measure the psychological and mental condition. Normally, we will look at some chart. We have a degree of chart from 1 to 10, whether how upset you are, how emotional you are. We hope that in the future there will be some objective parameters to measure those mental or stressless conditions. One of the direction is to try to measure the heart rate variability to evaluate the psychological stress change up and down. The heart rate hit like this, stop by stop with rhythm, but the rhythm is not consistent. Well, the variation won't be too much, but if the variation is great, it will be a big problem. We have found out that the heart rate variability degree can reflect the nervous systems, how it respond to the stress. Our body would have respond to the stress through different nervous system. The sympathetic nervous system will, under stress, will be very active. At that point, we found that the heart rate would be faster because it is getting the body prepared to deal with those challenges. So it's a protection mechanisms. By measuring the heart rate variability, we are able to objectively to measure the stress level of our body. It's a good news. On our daily device, like the watch and some variable device, come with those kind of functions that include the heart rate variability monitoring. So if you have those kind of device, please take a look to see the stress level on a daily basis. There are some other new developments in Hong Kong. The Chinese University of Hong Kong, the Faculty of Medicine, in June this year, like what Dr. Sa, that one report indicated a genetic indicator which can predict the incidence of heart disease. To measure the diabetes, the finding in this study of the University of Hong Kong, Chinese University of Hong Kong, people with diabetes has a 2 times more chances of having a heart disease. It successfully to find a gene that PDE1A is a predictable measurement. If it is successful then it can be used to more accurately to measure the treatment direction of the heart conditions. So we don't have to wait until the crisis arises. We can be preventive. If you are interested in double heart disease, so you can go online and go to the internet. There are many resources. There's a Dr. Wu. He is a leading scholars in this area about the double heart disease. The next slide. I hope that today bring to everyone some new perspective, a new direction, information. Thank you very much for having me today. Let's get back to Barbara. Thank you, Dr. Young. Optimism is not easy. It's really hard. I hope everyone try your best. You can, whether or not you are living with this chronic disease or heart disease, try not to be keep dwelling on the disease and making you less optimistic. Try to be relaxed, and there are many ways to deal with those situations. There are many ways to educate yourself, to help yourself. But you have to make some changes in terms of the lifestyle and your diet patterns, and also you have to know how to live with those chronic disease and heart disease. Dr. Young has already introduced some community resources. I would like to stress there's an organization called Canadian Mental Health Associations. There's a program called Bounce Back program. It's a program for depression and anxieties and to manage your mood conditions. Instrumental DVD available in English, Mandarin, and Cantonese. People could use the workbook, which is in English and Cantonese. Through this program, you are able to look into yourself, reflect on your mood condition, or whether or not there are issues that you can deal with them. It's a very helpful program. This program has been in operation for many years. You can go to Canadian Mental Health Associations. There's a website here, and also look at other programs, or you can do it at home. The other one is Anxiety BC. It's a free online tool helping people with anxieties. Those are many tools. It's called My Anxiety Plan for Adults. It's a step-by-step guide to managing your anxiety, and also how to self-manage your conditions. We have tried to find out whether any Chinese information is available. It's a little bit difficult. You can go there and try and look at the English materials. Okay. Next, we have two. You can see on screen there are many other community resources. If you cannot write them down, we will let you know where to find those resources. Dr. Sheller and Dr. Young, and also all the specialists yesterday, all of them indicate that we have to stay active and to start exercise, whether or not to keep ourselves physically fit, or also to deal with the stress. We have two physiotherapists today to talk about a topic like this. Welcome, Emily and Nicole.
Hi everyone. Thank you for taking the time and talk to us today about what is an active life. Okay, it's your turn. Thank you. So let us introduce ourselves first. I am Emily Pack. I am a registered physiotherapist in BC and also an IMS leading practitioner. I'm also a yoga instructor. Hi, I'm Nicole Tai. I'm also a registered physiotherapist in BC, and also I just finished my course in IMS leading practitioner. So our learning objectives for today is hopefully after you've listened to this talk that you know doing exercises is good. What are the benefits to your heart? How can you do exercises safely and not hurt yourself, injure yourself? And what are the ways to prevent sports injuries? We'll talk about those later on. And actually, exercises, there are lots of benefits to them. What are the benefits to the heart? Now, doing exercises, there's so many benefits. For example, you can reduce your stress. You can also improve your general health, as well as improve your circulation. And in the long term, you can also increase your immunity. And most people like this part. You can manage your weight loss. You can manage your weight. So it's also good for your physical health as well as mental health, and also leading a healthy lifestyle. Now, doing exercises, what are the benefits to the heart? Many of the people who have heart disease, they are worried about a relapse of their condition. So doing exercises will reduce the chances of or risk of having a relapse because it can improve our blood sugar and also cholesterol and control them. And in the long term, doing exercises can also manage our weight as well as improve our strength and endurance. And also it can increase, it will promote our blood circulation. Now, how can we do exercises safely? So let's look at that. Now, for those who have cardiovascular disease, they should be careful that when they do exercises, they should regularly monitor their blood pressure. If it's too high or it's too low, it's not the time to do exercises. Also avoid head-down positions, meaning don't do a headstand or don't bend forward for too long, otherwise the blood will flow down from your brain and you get dizzy. And don't hold your breath when you do exercises. Like when you lift the weights, don't hold your breath. Okay, and then we have to do enough warm-ups and keep hydrated. And so don't avoid high-intensity exercises. Don't run for too long, don't jump for too much, or don't aim for competition level exercises. If there are emergency situations, you have to be careful how to deal with them. For example, if you experience headaches, dizziness, flushing, chest pain, shortness of breath, or legs cramping during exercises, you have to sit down or pause or lie down immediately or seek help from other people. Because if these situations happen, if you don't stop immediately, if you pass out, you may knock your head, and that's not good. And so many people want to know what types of exercises are good. Well, actually, there are two types of exercises. One is aerobic. We call that aerobic in English. And the other one is called strengthening exercises. Actually, what are aerobic activities? There are moderate, vigorous exercises, moderate and vigorous, 3 levels. So moderate is simple. Moderate is also when you can chat easily, and when that's moderate. When it's moderate, then it's also chat easily, although you may not be able to sing. So don't do karaoke when you're doing moderate exercises. And also there's vigorous exercises where you can not chat easily. So, and ideally you can do more than 150 minutes of exercises in a week. What are the benefits? It can promote your heart, lung, and blood vessel health, and also you can do your housework easier. What about muscle strengthening exercises? So what it is it uses your major muscles. For example, your thighs, your calves. You do pushing or pulling or lifting, and there are two major groups. One is called a muscle power group, and the other is muscle endurance. First of all, for the muscle power exercises, what you do, you do heavier weights and do 6 to 10 repetitions. As for muscle endurance, you can do lighter weight and you can do 8 to 10 repetitions, and then you will feel hard, and optimally, then you can do it 2 to 3 times a week, and actually there are many benefits to that. What it does is it makes your muscles stronger when you do gardening, and also carry your grandchild or grandchildren or great-great-grandchildren, and help maintain your bone health as well. Now, so there are so many good benefits for doing exercises. So how much should we do? So according to Heart and Stroke and Public Health Canada, the recommendations for adults are at least 150 minutes a week of moderate intensity aerobic activity, broken into sessions of 10 minutes or more. So don't do 150 minutes on Monday and then be a couch potato for 6 other days of the week. So, and another thing is you do at least 2 days a week of moderate to high intensity muscle strengthening activity. So if you can do 150 minutes a week, then you pass. If you can do 300 minutes, you get an A. So don't start from zero. Okay, so if you have not done any exercises at all, what you do is, well, yes, you're starting from zero, but so we don't ask you to do 300 minutes the next day. So you have to do it gradually, increase the intensity and the amount of time gradually. And another thing is about aerobic training guideline. So for example, when you run or swim or do ballroom dancing, and that's aerobic exercises. Optimally, you can do it 3 to 5 times a day. The intensity should be moderate intensity. The time should be between 20 to 60 minutes, and you should use your large muscles to do rhythmic aerobic training. So how to monitor exercise intensity? Well, there is this rating, this modified Borg scale. The simplest scale is this rating of perceived exertion that goes from 0 to 10. So yes, like I said, it's called rating of perceived exertion. When it's 0, there's no exertion at all. When it's 1, it's very light, and all the way to 10 is maximal exertion, and you may have muscles, you may have sore for 2 or 3 days afterwards. So the optimal rating would be between 5 and 7. And also some younger attendees, if they have an Apple Watch or a watch like that, you can check your heart rate. If you don't have one, you can still monitor your heart rate. How do you monitor your heart rate? So this wrist just under your thumb, you put 2 fingers there, and then you can measure your pulse. Then you count to 15 seconds. You time to 15 seconds and count how many pulses there, how many beats there are, and then you time, and that amount times 4 will get you your heart rate per minute. Now, as far as exercise intensity, how do we calculate that? We have something called a heart rate reserve. So this is the maximum, that's 220 minus your age, and then minus your resting heart rate. In other words, when you're sitting down, when you're not doing activity. So that's your heart rate reserve. So there's an example here. Well, another way to to measure your intensity is a talk test. For example, if you can talk and sing at the same time, then it's a light activity. But if you can talk but you cannot sing, then it's moderate. And if you have difficulty talking, then it's vigorous. So that's how you measure your intensity. So like I said, if it's difficult, even talking, then it's vigorous. Okay. So that means I cannot be doing exercises when I'm interpreting. Okay. How do you prevent injuries? So we are concerned with your safety, of course. So when you do exercises, so don't get injured. Okay, now, there are ways to prevent injuries. We have some tips for you here. Now, remember, before you do exercises, and even afterwards, you should warm up and cool down. For example, if you're doing stretches or marching on the spot, then you can be sure that you will not pull your muscles, and we should avoid doing activity in extremely cold or hot weather. That's not suitable for doing exercises, at least outdoors. So that means doing indoor exercises will not have these limitations. And remember to stay hydrated, and also carry fast-acting carbs with you, or some people use electrolyte drinks to help replenish their energy. Okay, there are ways to prevent injuries. So be sure you carry your medical identification card with you, and you should tell your family or friends where you're going when you do your exercises, and you should be able to tell your medical practitioner what kind of medications you are taking and what kind of illnesses you have, so they should know about this. And so for those who have heart problems, they should choose activities that are suitable for them and nothing that's too intensive. And if you are not feeling well, you should stop immediately or seek help. So at this point in time, I think most of us would want to know, can we do exercises at home? So we have some recommendations for doing home exercises, aerobic and strengthening, both. So let's do some of them. Now, we will divide them into upper extremity strengthening and resistance exercise, like lifting weights. So this is an exercise where you use two bottles. So let's play the video. Maybe the video doesn't work. What you do is you hold two bottles of mineral water. It doesn't matter what brand. So you do it this way. You lift. Yeah, it could be any kind of mineral water or this bottle, or even what you do is you lift slowly and then you put it down slowly. So you should feel that there's a pull on the shoulder. That's where you exert. So you can do 10 reps on each arm, and do 3 sets of 10 reps on each arm. And then you do a lower extremity strengthening exercises where you can sit or stand or half squat. So do it this way. Yeah. Now, so find a safe chair, and then you can slowly sit and then slowly stand, like what Emily is doing. And some people may not have a good balance, so you can use your arms to rest on the back of the chair for support, and then you can use your arm on your shoulder and then come up. And then if you're good enough, you can just hold the back of the chair and then squat down slowly and come up slowly. Remember, your knees should not be as low as the toes, and your buttocks should be like that. You do 3 sets. So remember to find some stable chair or furniture to do it. And then the next one is a lower extremity strengthening exercise you can do it tiptoe. So this is to train your calves. So this is our second heart actually. So when it contracts, the blood will come back to the heart. So when you do that, you want the blood to go down to your calf, to your shin, and then look what Emily is doing. She's doing a demonstration now. So she pushes down, and then she tiptoes. So to the utmost, and then come down slowly, and do it for 5 seconds, up and down 5 seconds. Do 10 reps. Pause for a little bit and do another set. Do 3 sets all together. Okay. Now, there is a balance exercise. Now, I think a lot of people know how to stand on one leg. Well, in Chinese, we call it a golden chicken. So a golden chicken knows how to stand on one leg, but you have to be steady. So you have to hold on to a steady chair and lift your leg slowly for as long as you can, but don't tilt. Stand straight, and then slowly until you don't have the strength to hold on. So you do it for 10 reps on each leg and 3 sets. If you're good enough, you don't need a chair, then you can just do it on your own. Yeah, stand on one leg, and if it's stable, also the same number, 10 reps and 3 sets. And then you become a golden chicken. And then the next balance exercise is stepping. Yes, it's like marching on the spot, but this is more dynamic. So this balance exercise is you march on the spot. It's like a soldier marching. So this is a balance exercise. As you can see that just put your hands on the chair. You can march for 1 minute or as long as 3 minutes. Remember, if you are tired, then you just sit down, and you don't have to hold on to a chair. You can just do it on your own and march on your own. Or if you have a box or a book that you can hold on, and you can also step on the book or a stool or a book. So you can do it between 1 and 3 minutes. And then the next one is aerobic exercise. So what is aerobic exercise? So we have to do it for 3 to 5 minutes. So when you a little bit short of breath, so you have to build it up gradually. You don't do it 30 minutes in one go when you start on the first day. So if your balance is not so good, then you can do it sitting down. So it's simple. You just lift one leg up, and then use the other hand to tap on this leg. It's like marching. So right hand tapping the left knee, left hand tapping the right knee. So when you start with 5 minutes and then build up. So when you do it, you may be a little short of breath, but like I said before, so you want to do it up to a moderate intensity in a way that you can still talk when you're doing it. If you feel steady enough when you sit, then try doing standing. It's the same thing, but that you're doing it standing. And so don't lean forward. You have to stand straight. Okay, just lift your leg and then use the other arm to tap your leg. Next one. Now, if you feel that, oh well, this is too easy. Okay, well, let's have something more challenging. Now, that's doing something across. Hey, don't think this is too easy. Actually, this one is to train many of your pelvic muscles. Especially, you can do things like stand on one leg or jogging or running. You need that kind of strength. So it trains your core muscles. And do about 5 steps on each side, and do 10 steps, or do 5 reps. Just be sure that you are safe and not make it too hard on yourself. So if you can do it, then you can get to the next level. That is, you do it diagonally. And so this is one of the aerobic exercises. The next slide now. So overall, there is so much information that we've shared with you. What we have in mind is to keep you active, and then you develop an exercise routine, and you can do 15 minutes at home or even up to 20 minutes. So within those 15 minutes, you can do stretching, or you can do these like making arm circles with your arm, or raise your calf, or run in place. So you can try those exercises we just demonstrated to you. So as long as they are safe and stable. Thank you. Thank you very much. Thank you, Nicole and Emily, both of you, for your such explained, detailed explanation. We cannot be impatient when you do exercises. It's not like when you start doing exercises, you want to run a marathon the next day or do a triathlon. No, you don't do that. So you have to start slow and do low intensity, and then increase the intensity level and the time, as well as the repetitions and other. So I'm sorry, we were going to play some video, but the videos just got frozen. Anyway, we hope that all these presentations from yesterday and today, we can put it on the iCON website and show it to you, and you can watch it on YouTube. So a little later on, we will have a Q&A session in which some answers will come for the questions. Now, we want to tell you some of the community resources. So over these 2 days, we have already talked about it a few times, this HealthLink BC. Actually, there's a lot of information about diseases, chronic diseases, and recommendations, articles that you can read. And it comes in many languages, including Chinese and English, and you can read them on your own. And and there's a very special community resource that is physical activity services at HealthLink BC. So what it does is that it offers phone service, and if you call 811, you can connect with them and ask them questions about sports, about doing physical activity. They have professionals to answer your questions or to answer your inquiry. So, and if you click on the HealthLink BC, the physical activity services, then you can find out their office, the operation hours, and all that. So I strongly recommend you to use this link and these other community resources. And you can see down below, there are also other community resources that you can that are available to you. Next, we hope that we can show you some more community resources. You've heard me talk about some of them, but now we have some videos to show you so that you can learn more about community resources. Okay, after you've watched them, I hope that you will learn a lot more about community resources for those who have heart disease, how to get support from them, how to get help from them. And during this time of inflation, what kind of ways to help improve your health with heart disease. I said before, the HealthLink BC is our strong recommendation. That is actually the 811 was founded by the provincial government, so you can listen in. So for those who want to listen to Cantonese, just stay on the same channel.
Technology's changed our lives. Think about how we bank and book holidays. We still rely on professionals, but we're doing more ourselves, using phones, computers, and apps. It's not extra work, it's extra control. We like that. And that's where healthcare is headed. Now, we've always fixed simple health problems ourselves, asking friends and neighbors first. But who hasn't wanted more reassurance? That usually meant a trip to the doctor or hospital. Today, that's changed. We have instant access to incredible health information, however we want it, not to mention unbelievable tools and services. Just check out HealthLink BC. HealthLink is a 24/7 service that helps patients manage their own health. But what it really does is empower us. Let's start with HealthLink's phone service. When you dial 811, you're connected to a health system navigator who guides you to the expert you need fast. A nurse, a pharmacist, a dietitian. Experts who are trained to deal with problems over the phone and with access to 130 languages, no less. Imagine how useful that would be if it's the middle of the night and your baby is running a fever. Instead of going to emergency, you can get a health professional to walk you through proper treatment right away, right at home. Online at healthlinkbc.ca, there's medically approved information on thousands of health topics, tests, and procedures. You can check symptoms, find local resources, learn how to maintain a healthier lifestyle, even email dietitians for advice. That's exactly what the anxious mother of a child with food allergies did. She went online, got connected with a dietitian, and together they created a meal plan for her child. Now there's a mobile app that has lots of the same information. With its mapping function, you can even locate the hospitals, clinics, and pharmacies closest to you. Of course, there's always the BC Health Guide Handbook. You can find it at your local pharmacy. The handbook walks you through 190 common health concerns. It's super handy. In fact, there are even stories of people from BC using it in the US to avoid going to the hospital because they didn't have insurance. So you see, these are great services. 811 helps about 1,200 people a day across BC, and healthlinkbc.ca gets over 10,000 visits every day. These services take patient empowerment to a new level, supporting the biggest untapped resource in healthcare. Us. That's a connection worth thinking about.
So if you have time, go to this 811 to see those information. And next, we will try to give you an overview of our iCON website, which provide many information and also past video of the forums. So we would like to take this opportunity to how to navigate our website and also try to go over this whole website. This video is in Cantonese, so if you want to listen to it, then you could listen to the interpretation.
大家好，我哋而家會簡單介紹下點樣瀏覽我哋安康健康網絡嘅網頁。我哋中文版嘅網址係 chinese.iconproject.org。只要喺瀏覽器上輸入返我哋嘅網址，就可以到達我哋中文版嘅首頁。我哋嘅網站分為好多唔同嘅部分。首頁就會介紹一啲最新活動，同埋發布一啲精選文章。活動頁面就會俾大家觀看返以往舉辦過嘅講座影片。 同埋預先登記即將舉辦嘅活動，健康信息嘅部分就會包含一啲有關慢性疾病同埋數碼健康嘅資訊。我哋會定時更新一啲有關生活同埋健康嘅博客，然後上傳喺博客 blog 嘅頁面。 至於關於我們嘅頁面，就會介紹我哋安康嘅工作同埋我哋嘅團隊。咁如果你有任何問題或者意見想聯
Contact us. Let's go through the homepage now. You will see on homepage latest event and feature blogs and our latest resources. If you are interested, press Learn More to get more information. Scroll down, you will see an overview of iCON. Now we move on the event page. When you press event, it brings you to this page with a poster. Press View More. It will bring you to some upcoming events. Press Read More. You will see more details about those events. We recommend you to register first so that you will get the Zoom link before the event. Press Register now. It will bring you to the registration page in English. If you want to turn this page into Chinese, pull down here. You can choose traditional Chinese or simplified Chinese. The Chinese registration page shows up. You will see the date and time of the event. You need to fill in information like your name, email address, if you want to join the mailing list, and questions that you want to ask the speaker to answer. After filling out all those information, remember to press the button Register. After the registration is complete, you will receive an email confirmation, which will include the Zoom link for the event. On the day of the event, just click the link and you will be able to join. If you want to go back to the event page, press Back to Event up here, and then press Event again. You can go to the previous event video. Videos will be arranged from the newest to the oldest, from top to bottom. If there are more than one event coming, you could see the other event here. You can also filter event by the topic under Filter by Type. You will see forums on different topics and the date. You will see a blog Watch Recording. If you want to watch the recording, press this white block. It will bring you to the page with the general information about the topic and also other resources about the event. Each event comes with a common resources to give you an overview. Press here the blue buttons. It will bring you to another document file. If you want to watch the video recording, you can press this page, press this white button, watch recording again, or press this blue button. It will bring you to our YouTube channel. If you want to watch more healthy living topics, we welcome you to press the subscribe button under here. Now we move on to the health information page. When you press the button Health Information, the screen will pull down with different content on topics with different resources for health management. You can pick the topic that interests you. If you are looking for some specific topics, you can go to the right top corner where there is a magnifying glass. Type into the topics such as heart disease and then press the magnifying glass up to the right. It will bring you to the web page on heart disease on our website. No matter which page you are in, if you scroll down to the bottom, it will bring you to our contact information. You can join our mailing list and also our social media. On top of the screen, you can always find the menu bar. You can go there and the place you want to go, like the home page, you can go there. If you want to join our mailing list, press this white block. Then fill in your name and email address. Then check the item that you want to join. After that, press subscribe me. It will be completed. We will inform you by email of any upcoming event or latest information. If you want to follow us on social media, just click the social media icon in circle. Now I want to show you how to bookmark our webpage so that it will be easier for you to browse our homepage. Say you want to bookmark the page that we have just visited, say the event page, we first press event on the menu bar. From the browser to the right, there's a star symbol. You press the star and then it is done. You can then bookmark this page to your browser. You can see where it is pointed at. It is shown here. Every time when you go to your browser, it will go to the event page. You will be able to see our latest event. For more information, please contact us anytime. Yes. I hope the short video will help you to know how to navigate the iCON website to see more information, or the forum of last today will be uploaded to this our website. You can refresh what you heard today, or those friends who missed these today's forums, that you can refer them to go there. The next one is, because we are talking about heart, so we would like to invite the Heart and Stroke Foundation. They have prepared a video to tell us how to navigate their website and also how they help everyone in the community.
Thank you to the Intercultural Online Health Network for providing culturally tailored education and access to resources and programs for at-home self-management, and for inviting Heart and Stroke to be part of this forum. We share in their goal to help patients and caregivers optimize their quality of life by empowering them with knowledge and resources to manage heart disease. Heart and Stroke is one of Canada's leading health charities and began as a canvassing group organized by wives of cardiologists in Kingston, Ontario, over 70 years ago. We have grown to be a credible, trusted organization, and we are extremely grateful to our almost 1.5 million donors and 250,000 volunteers for their support. Over the past 7 decades, the death rate from heart disease and stroke has declined, but they are still the second leading cause of death in Canada, and there is still much more work for us to do. Many Canadians do not know enough about heart disease and stroke, and this is putting their own and their loved ones' health at risk. This is why we are so grateful to iCON for the work they do to support our cause. By raising awareness, improving prevention, saving more lives, and enhancing recovery for people living with heart disease, stroke, and vascular cognitive impairment and their caregivers, we will drive impact and improve health outcomes. Our employees serve people across Canada through research funding, providing information resources, and pushing for healthy public policy and best practices in our healthcare system. We have a robust online presence and active and engaged social media channels. As the largest non-governmental funder of heart and stroke research in Canada, we have invested more than $1.6 billion since we started our work. We are always striving to achieve the greatest health benefit for the largest number of people, and we are passionate about our cause. Despite our success, heart disease and stroke continue to take a serious toll. There are more than 3.5 million people in Canada living with heart disease and stroke, and sadly, a life is taken by these two conditions every 5 minutes. 9 in 10 people in Canada have at least one risk factor for heart conditions, stroke, and vascular cognitive impairment, but we know 80% of premature heart disease and stroke are preventable through lifestyle modification. A recent survey we did showed that many Canadians do not know enough about heart disease and what to do if faced with a serious medical emergency. I would like to take just a few minutes to quickly go over the signs of a heart attack and cardiac arrest so you are more aware of what to do. For a heart attack, if you experience any of these signs shown here, such as chest or upper body discomfort, shortness of breath, sweating, nausea, or lightheadedness, call 911 immediately or have someone call for you. Know, too, that the signs of a heart attack can be different in women. While the most common heart attack sign is chest pain, women may experience pressure or pain in the lower chest or abdomen, dizziness, upper back pressure, or extreme fatigue. A cardiac arrest is different from a heart attack. Cardiac arrest is often referred to as an electrical problem, and it means the heart has suddenly and unexpectedly stopped beating. Heart attack is often referred to as a plumbing problem of the heart. The blood flow to the heart is slowed or blocked. If someone is in a cardiac arrest, call 911 immediately. The dispatcher will send help right away and tell you to start CPR and use an AED if it's available. Signs of a cardiac arrest includes sudden collapse, unresponsive to touch and sound, and not breathing or making gasping sounds. We have information and resources available on our website for people living with heart disease, such as Living with Heart Disease and Living with Heart Failure. These tools provide useful information about managing chronic conditions, such as partnering with your doctor, navigating existing resources, and rehabilitation. They also can be ordered and mailed to your home at no charge. Visit our website, www.heartandstroke.ca, and click on the Heart Disease tab in the upper left corner. Scroll down to Recovery and Support. Click there and scroll again to the section called Living with Heart Disease. There you will find information on living with heart disease, taking control of your recovery, and other tools to help with your recovery. To order copies of our health information publications that can be mailed to your home at no charge, visit our website and scroll down to the very bottom, look for Patients column, and click on Health Publications. Then click on How to Order our Heart Disease Recovery to print specific chapters of our Living Well with Heart Disease book or our Living with Heart Failure book. You will also find a link to some Chinese resources. On the Chinese page, you will find a resource available in traditional Chinese on heart failure zones. We're working on one in understanding heart failure in traditional Chinese too, so stay tuned for that. We also know people who have had a stroke or heart attack need psychosocial support beyond the information and education we provide. People have told us this gap after diagnosis and during recovery and how hard it is to connect with others with similar experiences, regardless of where they live. Recognizing this, we have created and managed 2 private Facebook groups called the Community of Survivors and Care Supporters Community, where people can engage with each other and with experienced facilitators. These groups offer a safe space for people to connect, to receive peer support, learn from others, and access resources. To join, click the Heart Disease tab, go to the end of the list to Recovery and Support, scroll down to the red ribbon and click on Join Us. Then scroll down again to Community of Survivors and Care Supporters Community to join. We also engage with people with lived experience through our monthly e-newsletter called Community Connect. Through this newsletter, we provide people with lived experience with practical tips, downloadable resources, as well as opportunities to take part in research studies, surveys, focus groups, or other projects designed to enhance recovery and wellness. Thank you again for the opportunity to share who we are and how we can help. Together with you and with our partners like iCON, we are working to prevent disease, save lives, and promote recovery through research, health information, promotion, and public policy. Thank you again. Bye-bye.
係啦，好多謝心臟中風。
Thank you for Heart and Stroke providing this video and how to navigate the website, and also information are available. So if you have a moment, so you can go there and get some general information, and they are useful. And Earlier today, we have advised that there are many resources available to everyone. So some of them you need to go there and to search for. We have prepared a valuable gift for attending this health forum. The top tips from every speaker, along with this link for our community resources, have been created into one document for you to download from the iCON website, so that you can read and use them for reference, and they are printable. You don't have to worry about that. I haven't unable to drop down everything, or those key points, and also resources. Don't worry about that. So many information. You can go to our website and to get those reference. The Q&A section. I would like to bring back Dr. Yang and also two physiotherapists.
Hi, how are you guys? Thanks for staying and answering our questions. So people in the audience, if you still have questions, you can still write them in. I'm sorry that the cardiologists and other medical practitioners are not here to answer questions, but if you have questions for them, we hope that come January we'll have another session where we can answer all the questions that you have submitted. For the time being, we have just a few questions for you guys. I want to ask Dr. Young, you were talking about reducing stress. So what are the ways to reduce stress? Really, I mean, usually if you're too busy at work, you don't have time for any doing any fun things. So people say that, well, you can do things to reduce stress. I don't have time for that. I have very busy work schedules. What can we do? What ways that you can recommend us to reduce stress? Well, it's a very good question because I have that problem myself. Well, let's put it this way. Well, I'll tell you some good news. It's not like I have to sit down still for 1 hour or go to the gym to run and all that. Very simple. You know, even 3 minutes and 5 minutes you can start that. That's already enough. It's a good start. And if you can keep that up, just take a little bit of time every day, 3 to 5 minutes, like Emily was saying, those exercises, you do a little bit of that, start with 5 minutes and build up, and then make it a routine, and then you can build it up gradually. That's the optimal way. So there are many, many tools. For example, singing, dancing, drawing, writing poetry, writing essays, or simple enough, just go out and walk in the park, take a walk in the park. So that's one way to reduce the stress, Gesundheit. And then so you can just sit still. You don't have to like do this and do that. You can still do these things. So that is a very good recommendation. So whatever, wherever you are, or wherever you live, or what kind of environment you live in, you still can take advantage of your environment to reduce stress, to relax, to chill out, singing or dancing. Well, those are fun things, right? So yeah, well, I think you guys can learn how to sing and. Just buy a karaoke machine, you know. Yeah, you can think about that. I mean, if you don't have 5 minutes a day, well, there's still another way. Sleep. Yes. I think a lot of people agree with that, you know. So just drop everything and don't think about it. Just go to bed, sleep. Yeah, you're right. So if you cannot even take 5 minutes or any time to do anything, at least, you know, you can look at our sleep. Are there any ways to improve our sleep? So if you can improve it, that's already a progress. So talking about sleep, you know, many people, when I'm asleep, I I fall asleep for 1 hour, then I can't sleep at night. So what happens? Well then, what you need to do is before you sleep, before you go to bed, so you set your alarm clock, okay? And then when it comes time, so it wakes you up. So, but don't take a nap very late in the afternoon, like for example, before 1 or 2 p.m. you take a nap, and not to take a nap for longer than 20 or 30 minutes. That's the general recommendation. Of course, it all depends each person's health status. So, okay, if you want to make up for your sleep, fine. But I see some people who sleep for, like Barbara said, what, 5 hours. That's too much, man. Right, you're right. Yeah, that's a very good recommendation. Thank you, Dr. Young. And now, Em and Nicole, we have a question for you guys. This is a difficult one, maybe not for you, but an attendee says he wants to know, she wants to know that she here has to improve his or her lifestyle to do exercises, but this person wants extreme or sedentary like couch potato, right? So to start, how to motivate this person? Yeah, people like a couch potato. Well then, like Dr. Young says, to start with, when you start, don't ask too much for yourself. 3 to 5 minutes is a good start already. So if you don't even start with 3 or 5 minutes, no, you can't make it. So have a good start and then be persistent, okay? And then you said like in the morning, after you wake up, after you brush your teeth, after you have breakfast, you give yourself 3 to 5 minutes to do some exercises. That's not too difficult, right? So when you start developing that habit, do it every day, then you develop a good routine. So after you've started this routine, then you will notice some physiological changes. A lot of people notice that, I have more energy, I can sleep better. So because after you're doing exercise, you've exerted. So at night you feel more tired, you sleep better, and you have more energy, and you want to do more exercise. It's a good cycle, not a vicious cycle. A good cycle. Actually, I think it's you can addictive. It could be addictive. For sure you have to know your health status. Maybe medical professionals will tell you, well, you have to do just simple exercises to start to reduce weight, or maybe you have some chronic diseases developing, so you have to increase your activity level and as well as the time to do activity. So you have to be determined, okay? And although sometimes you say that, well, doing exercises, it doesn't mean you have to run or you have to swim or you do strenuous exercises. I think some people will just, they've never done any exercises, but even a little bit of house chores, house activity, that's good enough. That's a good start already. So if you are so lazy, a lazy bone, but you still have to do it, right? Even vacuuming or dusting or mopping the floor, that's already some kind of activity. It's better than sitting there all day watching TV or whatever. So then you increase your time, increase your intensity a little bit. So it will help. Another recommendation is that, of course, different folks, different strokes. So, but some people like to do it at home. Some people like to be accompanied, or somebody lead them to it, or somebody to push them. That's better for them. Actually, there are many resources in the community. For example, in Vancouver, there are many community centers. For example, exercise classes. They're cheap and they're fun. So you can think about going out and join other friends and your buddies, and have an instructor lead you. Do it every week. It's not only good for your body, it's also good socially. Right. That's a very, very good recommendation. It doesn't matter which area you live in, there is always a community center which offers these facilities, and there are also classes for those who can join if you are interested in those. So that's a very good recommendation. Thank you. And then there's an attendee who wrote a question. Rubber band stretching exercises. Can you do it every day? Using elastic bands, is it good to do it every day? Yes, of course. Because elastic bands, there are different challenging levels. So I'm using different colors. So red is the easiest. So use do simple movements and then build up to more intense movements. That's no problem. When you do it, say after you've warmed up, or do you do it after you've warmed up, or how do you start? I've never done elastic bands. Well, of course, it's best to have warm up first. So we call it a kind of resistance. So we have one here. So it's it's for resistance, meaning you have to exert, you have to use some strength to pull it, and if you do not warm it enough, then you're likely to get hurt. When you pull, actually, it's kind of dangerous if you do not control it well. So remember, when you do elastic bands, use slow movements. Don't jerk. Don't go too fast. If you go too fast, and then you may sprain your muscles. Actually, elastic bands has resistance. It helps train your muscles. There are many ways you can do it. You can hold it for 5 seconds and then slowly bring it back, and so you strengthen your arm muscles, or you can put it on top of your head and all that. So many ways to do it. That's very good. Next question for Dr. Young is about depression. Okay, depression. I think this person maybe has someone who suffers from depression. How can you help this person? How can you start helping this person? Okay, well, that's a good question, but it's a very major issue. Well, we can look at it from different perspectives. First, how the mood, where's the source? What's the source of the, is it hereditary, or is it a long-term thing? Or so we have to find out in order to treat it properly. So generally speaking, there are many things that we can do. For example, if you want a quick fix, of course, then there's medications, and if it's hereditary or if it's genetic, well, maybe you can use some medications to help you. And then some maybe due to environment, those are temporary issues, so you can use some psychological treatment. So the general recommendation is to use both, okay? So that's the best thing to. In that way, you can improve your condition. So after we've learned all these strategies, we hope that we can find some resources to support us, our family, our friends, and everyone. So whatever it is, depression or anxiety, some are chronic, right? So what you need is long-term support to build up this support network. Chances of success would be higher. Yeah, so there are many ways that you can try, right? Thank you, Dr. Young. Now, one attendee has a question. Are there videos that instruct us self-balance? Well, just balance. I think you two ladies may have some suggestions. Balance when you do exercises, especially seniors. That is very important. Well, just now you have demonstrated and talked about the importance of holding on to something for support. Of course, they're wheelless; they don't have wheels, right? So, if you hold on to something that is mobile, then once you lose balance, you can fall, slip and fall. So that is very important to remember. Don't slip and fall. So the most important thing is to find some support. If you cannot do it standing, then do it sitting. Right. Actually, balance, it doesn't mean that you have to stand to get balance. When you talk about balance, it's not just the muscle strength, it's also the endurance. It's also a coordination of all different parts of the body. Simply put, when you do exercises, you can do it sitting down or standing. You can still train your balance. So on YouTube, there are many clips that you can look at. You can practice some yoga for seniors, or Tai Chi. Those are balance exercises, because the movements in Tai Chi, some of them, the golden chickens with standing on one leg, that also trains your balance. So on YouTube, this is an excellent medium. So you can find yoga, sitting down yoga, or seniors Tai Chi. Just so I am a yoga instructor, so I also teach yoga and mixture of yoga and Tai Chi. So you can try many things. So now there's so many resources. You can practice at home, or you can find professionals to teach you. And also, when you do exercises, the speed is also important. Don't try to go too fast, or to rush it. Thank you. Don't do a rush job, okay? Because it's not good for you, okay? So you have to pay attention to the rate of speed, as well as your postures. So if you are doing something that you have to stand straight or sit up straight, don't lean and don't tilt. So don't lean forward or don't lean backward. So the posture is also very important. Yeah, for balance exercises, even it can prevent elders from slipping and falling. So there are many resources that you can find to help you learn about doing balance exercises. Well, because of time limits, that's all the time we have for answering questions. So thank you, Nico and Emily, for answering those questions for us. So if anyone who missed the presentations of today, well, later on you can just click on our recordings on our iCON website, and if you have not join our email list, you can see on the screen here. And be part of our email list. So you can scan the QR code to join the iCON mailing list. And then in future, when we have activities, events, we will contact you. We'll let you know directly. We thank you to our speakers of today, Dr. Sedlak, Dr. Young, Emily, and Nicole, to share with us such information, and I hope that it can help everybody. And I also want to thank our funder, Patients as Partners Initiative. And we want to thank our community partners. There, you can see 15 of them on the screen, or actually 14 of 15. And also we want to thank our media partners, 8 of them here, to publicize and let the public know our work. And we also want to thank the partners at Viewing Hubs. Today we have 2. Yesterday we had 4. For example, CRC Health Center South Vancouver Neighborhood House, Success, and at the day program for elders, as well as Villa Cathay. And we thank you to our interpreters. I'm not going to name them all today. And we also want to thank, yes, again, our interpreters, and Shani, Wenhui, and Cliff. We thank LNB, the interpretation services, for doing our interpretation. Yes, this is our iCON website. If you have any questions or if you want to contact us, write us emails to our email address. And as we age, there are more risks of having chronic diseases. So these problems may make your body weaker and impact your quality of life. So if you have good lifestyle habits, and if you're persistent and make effort, you can still have good health. I hope that over the last 2 days, our presentations have been helpful to you, and that you will keep making good effort and just join us the next time we have our events. For the time being, thank you very much. Bye.